Hi, this is Dr. Dan Camo. I wanted to talk to you a little bit today about something called trigger finger, or also known as stenosing tenosynovitis. One of my son's teachers asked me why her hand hurt the other day, and after I kind of talked to her for a minute or two, I realized that I thought that she had the very beginnings of this trigger finger. It kind of comes on, I would say, a little innocuous sometimes, a little insidious. Generally, it starts off with some discomfort, kind of right over where you would get a weightlifting callus on your hand. Is the most common place, and apparently the most common fingers for it are your ring finger and thumb finger. And basically, what it is the tendon that bends that finger. There is a sheath that surrounds it, and it kind of goes through these little things that we call pulleys that are attached to the bones, and you can develop a nodule in the tendon, or a swelling of the sheath of the tendon. And what will happen is, as you go to bend your finger, it can lock, and then you physically have to pop it back open again. Generally, there's a lot of tenderness right in around there. So she asked if there was anything she could do about it. And I said, yeah, for sure. I'll find you a video on YouTube and I'll send it to you, and that way you can kind of see what I'm talking about. Turns out there are no videos on YouTube about this, at least not from what I would consider to be a really good perspective. So I figured I'd just make one, put it on YouTube, and then send it to her. So what you're going to do is one of the techniques that we use here a lot in the office is something called Graston technique. It's kind of a shunt off. The Graston technique, people aren't going to like this, but it's kind of a shunt off from gua sha, which is a traditional Chinese medicine technique, which is basically scraping. You're going to scrape down along the tendon, and if there's a nodule built up in that tendon, what you're going to do is you're going to scrape the tendon with, this is a plastic spoon. I like a metal spoon. Like, this is just for demo purposes only. Apparently we don't keep spoons here in the office, but I like a metal spoon. It's something that everybody has. You can buy these Graston instruments, or these soft instrument assisted soft tissue instruments that are really expensive. I don't use them because a spoon is really good. It's a nice soup spoon, and all you're going to do is you're just going to use a little bit of lotion, and just get a pump of lotion on it, and rub it into your hand a little bit, just so that it's not too crazy. And then you're going to take your metal spoon, not your plastic one. Plastic's no good. You're going to take your metal spoon, and you're just going to scrape downwards. Now, it's going to be uncomfortable to do the self-care on this. Like, if you come into the office, this is what I'm going to do to you, and I'm going to let you be a little uncomfortable while I do it. But for the most part, when you're doing it at home, I like to tell people I'm going to work you at like a 5 out of 10 on the discomfort scale. When you're doing yourself at home, you just need to be in like a 3 zone, okay? You don't got to try to drive a metal implement or a spoon through the other side of your hand. That's not going to be very helpful. But if you do a little bit, and you'll see, like, if I get right up there on a nice callus, take my wedding ring off, you want to kind of get, a lot of the time the joint that it gets stuck on is right here. And basically what you want to do is you want to really scrape in through there. And just, I'm doing all down strokes, because the idea here is that if there's any inflammation, you want to kind of push it down into the hand, and do it for maybe 2-3 minutes. Basically, you do it until the skin on the surface, if it's not too callous like mine is, if it's a little thinner skin there, what'll happen is the skin will turn red, and that's what you're looking for. That's the good zone to stop. Traditionally, you would put ice on it after that. We know now that ice is not really good for initiating the healing response, which is the whole reason why we're actually beating this tissue up. So I generally tend to tell people to put heat on it afterwards and really stimulate a good blood flow response, so that there's a lot of, that's probably controversial, and if somebody doesn't like that, they can write a comment in the Facebook or in the YouTube comments, and I'll deal with you by myself. But you're gonna go, and then you're gonna put some heat on it. Realistically, the first time you do this, it's not going to feel better. It might even feel worse. But again, don't drive the spoon through your hand. And if it does feel worse after the first time, second time, try some ice. But realistically, if you're looking to get it better in the shortest period possible, you want to really grind, not really grind, but like 3 out of 10 grind that spoon into there, and then heat it up to get a really good blood flow, really good heating response. You can do it probably, I start off once a day, and that's probably all you're going to need. Rub it until the skin turns red, or maybe like, maybe 2 minutes of moderate friction, downward strokes to help push some of the inflammation down into the rest of your hand. You can go down the rest of the line, but it's probably not necessary. I just focus in right on that area where it's locking, and take it from there. Do it once a day. Find somebody who knows what they're talking about when they're dealing with this and doing Graston technique or something along those same lines. Acupuncture works really good on this. Same thing. The friction from the Graston technique, from the scraping, and the pins from the acupuncture needles or dry needling, what they do is they cause your body to launch a healing response in that area. All right, so they provide an influx of all these different healing cells, macrophages, which break down tissue and that type of thing. And what goes on is, when you beat up that area, you perfuse the area with those healing cells, which is why getting blood flow into it with the heat afterwards is important. And those cells will actually start to break down the excessive collagen buildup in that tendon. Or if it's a sheath inflammation issue, it'll start to calm down that inflammation, start to go to healing that tendon sheath. So that's what you're looking to do. And try it out. Let me know how you figure it out. But like I said, try to find somebody, if you're kind of going through this on your own, find somebody who knows what they're talking about, and get a little bit of guidance too. Don't just go into it blind. Have good days.